Good morning, tribe. Thank you for joining us. We're here with Diane. We're going to talk about NCLEX Prep and all the good things there are to know about NCLEX, do some myth busting, which will be fun. So we'll give you guys a couple minutes. We're just going to introduce Diane and get a feel for what she's been doing and how long she's been in nursing, and then we'll get into the NCLEX questions that you guys brought to the table. Hi, Diane.
Hi, thank you so much for having me today. My name is Diane Evans Pryor. I am a nurse educator at a very large urban pre-licensure associate degree program in Albuquerque, so with Central New Mexico Community College. We are a very large program. We're one of the larger nursing programs in the country. And so, I work with lots of students as they get through the program, and I oftentimes still interact with students after graduation just to provide additional resources as needed. I've been in education. I'm just now starting my 17th year in education. I kind of fell headlong into nursing education at the ripe old age of 30, and it was serendipitous, but I think I was kind of destined for this. I had very short attention span in nursing. It's like, oh, I'll do this, and about after 2 years, I'm like, okay, I've done that. Now let's do something new. Oh, this is exciting. And after about 2 years, I'm like, okay, well, what do I want to do next? When I fell kind of headlong into nursing education, I knew immediately I'd found my home. I really, really love it. I'm incredibly passionate about it. And anytime that we can make the profession easier or debunk myths or things like that, I think that we owe that to our nursing population to do so. So I'm more than happy to be here today to talk about the licensure exam, the NCLEX, and to answer some of the tribe's questions that have been going around. So.
Awesome. I so love that you're here. Okay, so let's see. Our first question from the tribe was, well, I do want to ask you, what do you love most about education?
I love how hard it is, but not purely because of that. I love that it's very, very hard, but I love that my students get through it. Almost 90% of the students who start my program complete my program, and those are some amazing numbers.
Yeah.
And it's hard. It's not uncommon for students to fall back or fall off that bus for a semester, but we really want to get those students in, through, and out. And I just live for that aha moment when the student who's been struggling suddenly is doing questions. You're like, wait a minute, I know stuff.
Yeah.
That's really empowering. And when they see in the clinical, when their thoughts are in alignment with the assessment findings and they do something and it does what it's supposed to do, and the patient benefits, that's the passion that students have at that moment, reminds me that we should be passionate about that every single time we do it, not just when we do it the first time. But
yeah. Agreed. I love that. Okay. So some NCLEX questions, and then you can elaborate on the things that you have up your sleeve too, please. We want to learn from you. It says, is it true that they have random tests that have questions that don't count toward the results? It's just a survey.
Well, yes and no. So the National Council of State Boards of Nursing, they're the people who write the NCLEX. They have a legal and ethical obligation to ensure that the test is valid and reliable. So those are statistical terms to say that the test questions are measuring what they're supposed to be measuring, and that there's a certain degree of inter-rater reliability. So students who are high performing on the test typically will get those questions right. Students who are not high performers on the test will typically get those wrong. We do data analysis for our test questions, even within the nursing program. At our school, we measure no fewer than 4 points of validity and reliability for each of our test questions. And sometimes we have to make decisions about those test questions as a result. So occasionally we will even beta test some of our questions the first time through, just to see how students do on them, because we've written those ourselves. We want to make sure that we've got good data to say that this is a valid question to be asking. So the licensure exam is the same way. So the first 75 questions of the NCLEX, only 60 questions are actually graded, and those will be falling in with the computer adaptive algorithm that provides a slightly harder question when you get a question right, and a slightly easier question if you get that question wrong. So there will be 15 questions within those first 75 that will not be graded, and the test taker will not know at all which ones are which.
Okay.
So, and then the test statisticians, there's a special name for that. I forget what the name is off the top of my head, but they go through that data and they decide, okay, yeah, this is a valid question. Next time we do the exam, we'll include it.
Okay.
Now, as far as the survey is concerned, yes, as of, I believe, through June 30th of this year, it started July 1 of last year, through June 30th of this year, the National Council of State Boards of Nursing are looking at a new kind of test question, and they're calling them next generation or next gen questions. So probably most students are familiar with select all that apply. Mm-hmm. So there's enhanced select all that apply. Maybe there's a drag and drop where students have to put something in order. Well, now the enhanced drag and drop will be here 7 patients and 8 patient beds. Room these patients appropriately. So there might be multiple levels where there might be multiple right answers, but students can drag and drop those students or those patients into those boxes and then make a decision. There's, I believe, 7 or 8 different types of these next gen questions. And I was just in Chicago 2 weeks ago and had an opportunity to hear the lead test statistician talk about how much this has improved the reliability, but they're still not sure about if this is what we need to do. Which of these enhanced questions are good and which ones the enhanced questions are maybe not so good? Are we really measuring what we need to? Do we have the computer systems in place to make sure that we can grade all of this variability? Because that algorithm is mind-blowing. So students who have been testing for the last year, if there's been enough time remaining on that NCLEX, they've been asked, hey, do you want to take these test questions? And they're very clear. These are not graded. They've typically been putting the students through about 10 questions. Okay. Maybe some students have gotten more, but that's been distinct and separate. So.
Okay. Good. Okay. And then are some people randomly chosen to do all 265 questions?
That is also a wonderful question. I hear it all the time. The answer to that is wholeheartedly no. There is no randomization to how many questions a student gets. So the minimum question set is 75. The maximum is 265. So as a student is testing, it's very, very important to remember, as long as there are test questions in front of you, you are still in the game. That is so wickedly important. I'm going to say it twice. As long as you have test questions in front of you, you are still in the game. So what happens? At 75 questions, the computer is going to look at the testing pattern and determine whether or not that student has, or that test-taking candidate has established competence, minimum competence. Mm-hmm. If the answer is yes, the test is going to shut off. If the answer is a resounding no, the computer system has enough information to say after 75 questions, there is no way that this person is competent, it will also shut down. If the student's somewhere in the middle, either not demonstrating the test pattern that the NCLEX is looking for, or they've just kind of been wandering all over the place for their performance, that student's going to get the benefit of more questions. And so we just don't know. I've heard of the test shutting down at 76. Like, I don't know what was in that one question, but apparently it was enough. And I've heard of students both passing and failing at that point. The more questions that you get throughout the exam is really an indicator that you're doing okay. You haven't convinced the computer that you're incompetent, but you haven't shown the system that you're competent either. So it just says, okay, you're going to get another question. You're going to get another question. Which is why, as you're preparing for the NCLEX, you really want to bring out your A game during that first 75 questions. You want to take your time and read through them. You want to make sure that you're reading for those key words. You want to make sure that you're breaking down that question clause by clause so that you understand what the question's asking and you're not missing key terms. And that's really hard to do when you're like, I'm sitting in front of the test and it's going on, and this is going to determine whether or not I get to get a job, keep a job, have a job. Those emotions are definitely playing. But if we can get students really to the point where they're so practiced at the testing process, deep breathing, whatever it is that they need to do to be successful, ideally we're knocking it out in that first 75. When I see students getting all the way to 275, it's actually the answer to 274 that makes a difference. Because if your question 274 is incorrect, it's going to give you an easier question. If at the question 274 you get right, you get a harder question. It's where that last question is on the milieu. If it's above the pass threshold, that's a student who has passed the exam. If that last question is below the pass threshold, that's not a successful exam. So it really doesn't matter how you answer that last question. It just matters whether or not it's above or below. So with a computer adaptive test, again, the algorithm is such that you get a question harder, you get a harder question. You answer it wrong, you get an easier question. And what it's going to do is it's going to push that test taker to the maximum point where they're getting every other question right, which means they're also getting every other question wrong. So it's that sawtooth pattern that the system's looking for. At which point, if that pattern occurs above the pass threshold, that's a passing test. If that sawtooth pattern happens below the pass threshold, that's a failing test. If that's wandering all over the place, or that sawtooth pattern happens at the pass threshold, that's a long one. There is one additional way that the test can be graded, and that's if you run out of time. So when a student runs out of time, so uses the entire 6 hours, the test is going to look back at the last 60 questions. And all of those, regardless of whether they are right or wrong, have to be above the pass threshold. If even one of those questions is below the pass threshold, that's a failing exam. So it's in a student's best interest to spend about 1.5 minutes per test question. 1.5 minutes means that you've spent enough time looking at the test question so that you're not missing keywords, but not spending so much time on that test question that you're talking yourself out of perfectly good answers. So that's basically how the NCLEX works in a nutshell.
Right. So how do you prepare your students? You said that if your students are prepared enough, then the NCLEX is easier. How do they prepare? What's your advice?
Well, I actually prepare my students before they ever even graduate from nursing school. So current pedagogical data, the research, pedagogy is a fancy word for teaching, about how people learn, and specifically for nursing education, suggests that successful students on the NCLEX will be taking a minimum around average of 10,000 test questions during the time that they're in school.
Wow.
So we have, we don't count them, but between the quizzes and the exams and the case studies that we do and a little piece of heaven called Evolve Adaptive Quizzing, which is a 16,000 question database that allows students to practice those test questions at their leisure, and we have assignments associated with that and level up activities. That pretty much hits our students at that. I can reliably say that we're hitting pretty close, if not a little bit over that 10,000 question mark. The other thing that students can do is between graduation and test day, successful students, again, this has been researched, will typically go through about 2,400 test questions between graduation and test day. And I will tell you that I am seeing a new population for at least my students of first-time failures. And because we're computerized technology, we've got all these systems are automated. So our students' degrees are getting processed and actually posting within about a week after graduation, a week to 10 days after graduation. Those degrees are posted. So that means that students can send their transcripts over to the Board of Nursing and they can test pretty quickly. For my students, I have an area for students who are testing about 4 to 6 weeks after graduation. I'm seeing about a 50% fail rate for those students.
Wow.
And it's a surprising list of names. It's like, wait, you were a good student. What happened? Well, I think what's happening is they're thinking I can, they're tired when they're done with nursing school. The last thing they want to do is spend X number of days, hours a day studying.
Right.
But if you're resting on your laurels from your exit exam or your final exams, and you don't practice those skills, your performance is going to drop. So at least my interpretation of this new population of failures, and again, it's not a huge number because they don't have that many students testing that quickly. But if that continues to be the case, early testing doesn't give the student enough time to prep.
Yeah.
And I suspect that early testing has students don't want to prep at all. Like, no, I did really well. I don't have to study. The answer is
and take the test, right?
Yeah.
Get it over with.
And I don't want to put that solely on the test taker, because employers are really bad about saying, well, when you go to test, you got to test, you got to test soon, you got to have a test, you got to test. And really, it's in their best interest to back off a little bit and say, listen, we know as employers that optimal testing is going to happen between about 8 and 16 weeks. So we don't want you waiting forever, but we also don't want you going so quickly that you haven't had an opportunity to continue to practice and synthesize. So I tell my students, and again, this is based off my data, but we're a big program in Central New Mexico. We're open access. We have a lottery for coming into the program. We don't rank our candidates. So I think that we're a fairly representative group.
Mm-hmm.
And we've got about 85 to 87% board pass rates first time. And if you go look at the second test attempt, that brings us up to almost 96%. So our students are actually accomplishing things that they need to. So I'm feeling pretty reliable about the information that I'm sharing with you today.
Yeah. So question about the testing during your program. Is that kind of a nationwide movement to where everyone is doing the HESIs and those kind of testings? Because back when I was in school, that wasn't a thing. So is that common?
It is common, and it's not just for test prep. Although that obviously, we as educators hate to say, oh, we're teaching to the test, but I think we do have a responsibility to a certain degree to teach to the test because they're going to be taking that. They need to be successful. There's also a bunch of skills and critical thinking that we need to do. But when a student graduates and sits for the NCLEX, the college is basically putting that green stamp on that student saying, I vouch for this person clinically. Now we just need to make sure that they can sit for the licensure exam to meet this minimum entry criteria.
Right.
So obviously standardized testing is very good for that. But as educators, it's also important for us to be able to compare our students' performance against national benchmarks. And this becomes really, really important, especially for smaller programs. On any given exam, I'm going to have a statistically valid number because at least 96 students are taking that test. For statistical reliability, you're looking at an N of 30. So I have statistical validity, but what about tiny programs that admit 16 students once every 2 years? There are programs like that in the state of New Mexico. It's very challenging for those folks to develop the same level of statistical validity and reliability that we take for granted in our program. So standardized testing then allows that program to compare with the statistically valid component. And then it's also broken down so that we can see, hey, our students are rocking on assessment. They're doing really well on interventions, but they're really not doing very well on evaluation or, safety. At which point we can take a look at that. Maybe not make radical changes based on that, but at least it improves our awareness to say, how can we imbue our current lectures and emphasize a little bit more on the safety things that we need to do, or culture. Culture has always been one for us here at CNM that you take a look at our bar graphs about student performance and everything's up here, and then we have culture, down a little bit. Mm-hmm. So based on that, we've been able to address that, pretty directly so that we can do some process improvement within the program so that we can see that improvement as well. So it benefits students and it also benefits the program.
Okay. So what types of test prep do you have? A certain where should they get their test questions?
Much to the chagrin of probably most of the people who are going to watch this, Quizlet is probably not the best place to go. Quizlet has its benefits. It's really great for like doing flashcards and, you know, doing quizzes for each other, but it's not juried. And I will tell you that there are some sadistic sons of guns out there that are deliberately populating Quizlet with wrong answers.
Oh.
And that's mean. It's mean, but it's not juried. There's not a nursing educator and they're going, yeah, that question's wrong. And then this is why. This rationale, the question is right, but the rationale is incorrect. Those types of things can happen. So one of the things that we've done in our program is to kind of lock these students in with some valid resources. And then, of course, my philosophy is reward what you value. If I want the students to utilize these resources, then we're going to have a lot of points associated with completing quizzes and level ups and things like that.
Yeah.
You know, my goal is to keep them busy enough that they don't have time for Quizlet. But when it comes to test prep, I definitely know that I could definitely say with enthusiasm that test prep is absolutely critical, but it's not one size fits all. And I did spend about 5 years as a test prep instructor for Kaplan. I'm more than happy to say the word Kaplan. They're great in the organization, as is Hearst, as is the NCSBN, as is UWorld. UWorld's really come up in the world. I've had to do a 180 on my opinion about them. But as a Kaplan instructor, I could tell at a glance which students wanted to be there and which students were made to be there. So the students who had Kaplan as part of their integrated testing package throughout the program typically were less engaged during the test prep, but the students who paid for it on their own were like, that's $400 of my hard-earned money and I am invested in this. I mean, both of them came out of the student's pocket, but one hurt a little bit more.
Right.
So I've really felt very passionate that students need to pick the prep that works best for them. And obviously, I have some students who don't have the ability to pay for prep. And I go and greet the students. I tell my graduating students what to expect. But I also let them know that, you know, if you're trying to make a decision between a test prep and food, you need to reach out to me because I do have some resources available to help those students. So top of the, you know, if you want to look at your Cadillac and your Hummer type, your Mercedes-Benz, Kaplan and Hearst are really top of the pile. Kaplan is a really, really good overall test strategies workshop. So pretty much any student would benefit, including high-performing students. Hearst review, also excellent, very, very high quality resources. They tend to be more of a content review. So if you were in a situation where you're at the end of that 16-week window when students typically do best on that test and you're kind of delayed or you're nervous, and that happens a lot. Like, I got a test, I'm not ready. Oh, I got a test, I'm not ready. I don't even know how to get ready. And I was like, oh, I've wasted too much time and now there's no way I can get ready. Hearst might be a better choice because it's been a little bit since you thought those nursing thoughts, and they'll reinforce the context. Kaplan, really great resources, definitely good for. They have a specific program for English as a second language. So even U.S. trained nurses who have consistently struggled with ESL. I mean, come on, we know that the NCLEX is hard for our native speakers. Can you imagine trying to take it in, you know, Spanish or Portuguese or something like that? It'd be ridiculous. Right. So those two are definitely top of the pile. Generally speaking, there are deals that you can make. Big schools typically will have some kind of, discount code or something like that. But definitely ask, because whatever their model price is, you can always get it down probably about 10 or 15%.
Oh, good.
Middle of the line, we'll talk about UWorld. UWorld made me suspicious initially because they never reached out to me as a program director to peddle their to let us know that they existed and that they were good.
Mm-hmm.
So I was always a little sketchy. And this is where I had to change my opinion, is it took them a while to get the statistical validity behind their products. So they have now changed my mind. I actually think they're pretty good. One of the things that I would really caution participants about, pretty much Kaplan and Hearst, you kind of need to be in front of a computer, but UWorld is very device friendly. I will tell you that standing in the line at the grocery store is not a valid testing environment.
Mm-hmm.
If you're in your car or you're in a waiting room or something, that's not replicating the test experience. You need to be doing this at a computer where you're not going to be distracted, where you can't have food and drink readily available. You don't have your children and your pets crawling up on your keyboard. You need to prep as though it's test day, because if you get a 265 question test, you need to be prepared to do the best you can. And if you've been practicing in a manner that isn't reinforcing that test experience, you're not getting the most out of your test prep product. So I really do suggest, because like I said, UWorld tends to be very mobile device friendly, really making a conscious decision that my test prep is going to be in front of a computer at a place where I'm not going to be distracted. But yeah, they seem to be just fine. Other end of the spectrum, the National Councils of State Boards of Nursing also have a test prep, and it's a subscription that's based on time. So you can utilize the resources are available to you 100%. You're just buying a 5-week, 7-week, 10-week, 15-week subscription. And those start at $50. So the smallest one is about $50. What I suggest is, if you're going to do something like the NCSBN Prep, utilize that with the standardized testing that you've already done in nursing school. So you took some kind of exit exam. Look at that as a place to start. If there's remediation associated with that exit exam, use that to tailor to your strengths and weaknesses. Do prep there, and then use the NCSBN as an external validator. So my Kaplan or my HESI or my ATI or my Kaplan resources are saying that I'm ready. Now let's go ahead and do that $50, 4-week or 5-week subscription with NCSBN, because they're going to be able to be a good external validator, and they are the people who write the test. You're not going to get any more valid information than NCSBN. Another pitfall that students typically do that I see is they'll pick, I'm going to do Hearst, and then I'm going to do Kaplan, and then I'm going to do UWorld. That is a huge mistake. Pick one and stick with it. Because if you just do a little bit here and a little bit here and a little bit here, those 3 resources or those 2 resources can't talk to each other. So you're not getting this holistic idea of where your performance lies in that milieu. Same thing with borrowing somebody else's access code. That's really doing yourself a disservice, because the computer thinks it's just one person. And it's 2. You're not going to get the valid information about your testing performance if you're piggybacking off of someone else's resources.
That's interesting. All right. Do you have any specific strategy in terms of during the test? Do you have any bullet points for them to process through things?
I actually do. And I'm more than happy to, probably what I'll do is I'll go ahead and send those off to the tribe, because we're getting close to the end of time. But I'd be more than happy to come back and do an NCLEX strategy session. But really, it really comes to how you prepare. As you're preparing for the NCLEX, one of the things that you should be doing is doing a 265 question exam. It is possible you will get one, and you certainly wouldn't run a 10K if you're a couch potato. Yeah. If you can't run around the block, you probably ought not be running a 10K. So you better condition yourself for it. So plan for the worst, hope for the best. If you know you've done a 265 question test, you know that at question 101 you're wishing for death. Okay, so how do you push through that? Because remember, as long as you've got test questions in front of you, you're still in the game. So what we've got to do is help that student get conditioned to the point of, when I'm really tired, this is what I need to do. I need to take an extra break. I need to close my eyes and meditate for 5 minutes. I need to, what is it that you need to do that's going to get you past that hump and get you back at your best performance?
Great. All right. Well, that sounds wonderful. Guys, do you have anything to add to that, Diane?
Nope. I'm just really excited to be able to get this message out. It's definitely one that I say it a lot. I say it to every single one of my graduating classes. But I really think that, we are a team. Your education, your school of nursing and the student, we're a team to help you get past, get you through the NCLEX. And if you need help, there's nothing wrong with asking for it. We'll more than happily to get you back on track. And failing the NCLEX isn't the end of the world. We know how to help students with that as well.
Yeah. Awesome. Thank you for taking the time to chat with us, Diane. It was so great to have you here. And students, if you guys, or new grads, if you guys have questions for Diane, stick them in the comments and we'll make sure that myself or Diane get back to you, okay? Thanks for joining us, Diane. It was great to chat.
You bet.
See ya.